Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. We have a great guest. No, you're not seeing double if you're watching this episode. We have some twins on, and they're the co-founders of Scene Health. How is it going?
Great. Thanks so much for having us.
I love it. I'm pumped to have. I think you're the first twins that have ever been on the show,
Yeah,
which
amazing. And
surprises me a little bit because
in different locations, it just so happens that we're both in the center together today.
that's awesome. I love it. I'm glad. Oh, perfect timing for us. Let's dig in a little bit. So first, before we kind of go into Scene Health, what causes brothers, twins, to want to start a business together in the first place?
Great question. Actually, this has been a premeditated journey for us for over 10 years. And so back in college days, the two of us thought that we actually have very different skill sets, similar aspirations, and we look alike. We're 3 minutes apart. We were like, other people go scour the ends of the earth to try to find the best co-founder. And here we are naturally born with one. We thought it was almost too good a story not to try to build something together. But we actually took entirely separate journeys. Everything went into strategy, the operations, and a bunch of different career paths. And for me, it was very much a straight line to Silicon Valley, really studying the product and engineering with some of the best companies and founders out there, right? And in many ways, we wanted to position ourselves as the best possible co-founders for each other. It just took us, 10, 12 years to finally get to the point we wanted to take the journey and finally do this together.
Now, talk me through like what were the moments that led to founding Scene Health?
Yeah, it really all starts during COVID when the two of us both quit our jobs and we spent a lot of time really thinking about what is a problem we wanted to tackle. And that coincided with perhaps the most difficult periods in our family's history in terms of dealing with the grandparents who raised us. Long story short, right, after a lifetime of health issues, it really culminated in a few different acute episodes that really brought the entire family together to think about what are the longer term implications of how do we care for them on a longitudinal basis, and all the financial, the personal, the energy wise cost of doing so over an extended amount of time. And despite having a large and supportive family, we still struggle to this day to find the right type of care. And that's what really got us to think about what can we do as we're really in the middle of our careers to try to build something that's worthy of our own family and grandparents. And that's what's ultimately set us on a path to dive into healthcare and in senior care in particular.
As it relates to pace, right? That um, the origins go back to like the 1970s, and when you look at what Scene Health is doing, right, you're kind of bringing things full circle with a culturally focused care model. So how do you balance honoring these roots while leveraging the modern technology to expand access today?
Yeah. We really spent the last 3 years studying everything we can possibly do for PACE, really understand the model, understand its historical challenges. And what we saw was that the model itself is incredibly complex. You're talking about a single organization, almost like a mini Kaiser, right? You're both a health plan as well as a healthcare provider. But there's all these logistics coordination pieces around staffing, around durable medical equipments, around appointments, around transportation vehicles, around foods. And all of this is being done by an 11-person interdisciplinary team that work across 20, 25 different platforms that don't talk to each other. So people hack around solutions using Excel, using email, whatever it is to just make their day-to-day work. But even despite all of that, the outcomes are absolutely incredible. And so from our perspectives and our experiences, we've seen how technology has really transformed how you call a car or how you collaborate with each other in other sectors. And we thought that like, what can we possibly do to bring those type of experience here to the pay sector? And honestly, the sector has been really underinvested from a technology perspective. And we see there's a massive amount of opportunity for us to build a almost single pane of glass type of operating system to enable the delivery of this type of personalized services at scale.
Now, let's talk about kind of you mentioned this a little bit, but technology's role in all of this. So You're combining AI devices in a pace centric EHR.
Mhm.
So let's let's dig in a little bit deeper in terms of how these technologies make a tangible difference in the lives of seniors and their families.
For sure. And the way we think about technology is really very expansive, but also centered around our staff, right? Well, given this population and all of that, we're not going to deliver applications that people will use every single day, that at least the participants. But instead, it's like we really look at it from the lens of like how do we empower our staff members to have the best available tools for the instead of them adapting to a EHR clunky system, it's really the system adapting to them. And really we like to talk about how do we give people the power of 1,000 assistants, right? And to really create time so that they can focus on what they are uniquely gifted and trained to do, which is making the complex healthcare decisions and being on the front lines, building that relationship with the participants, and understanding their unique situation, for everything else, right? And from the participants' perspective, it's about how do we bridge the gap of language understanding, of cultural understanding, of we aspire to for every single participant to never repeat the same answer twice. Right, and then on the staff side, right, we what we want to be able to enable is how do we reduce a lot of the compliance burden, the coordination burden, and the sort of charting that's so much a source of burnout and frustration for a lot of providers. How do we deploy sort of AI scribes and these automated tooling from the very beginning so that they can focus on, again, a lot more time on what they're uniquely gifted at. But it also is much more expansive beyond that too. And I would use one example for the particular population that we're going after. People are fairly frail, and a huge portion of folks suffer from dementia. And as a result, we need to be very careful about where folks are at all times and make sure that they don't pose physical risks to themselves, and make sure that we know that they're not wandering to places where they're supposed to be, we're not supposed to be. And typically, organizations deploy very clunky systems that are single purpose. For us, we actually deploy a state-of-the-art real-time location tracking system where we can know where a participant is at all times. And as soon as they leave a designated area or go into a forbidden area, it will immediately alert the nearby staff member so we can immediately act on that. So the result is much better response times, much better patient safety, all without the participants or the providers having to do anything specific.
Let's talk a little bit about uh, scaling here. So, PACE has faced challenges in reaching more than 5% of eligible seniors. What's really your strategy for scaling scene health while still maintaining the personalized, culturally attuned care central to your mission?
I would say we start at the very end, which is this. There needs to be more pay centers that exist. The barrier to entry is too high, and that there's will be growing demands and more diverse demands for the aging population of this country. And we ourselves cannot do this alone, and no organization can go out and build 1,000 of these centers, right? And so we almost start at the very end, which is we need these services to exist, and we can't build it just by ourselves. So we have to get into the game of just empowering others, which is why we're building both the technology pieces and the operations today. And for us is that like we took a very first principle look at what traditionally has been difficult for PACE, all the way from application pieces to capital pieces to actual real estate construction to vendor selection, deployments, ongoing operations. We're trying to take a very principled approach to attract to exactly solve every single piece of that. And where we're trying to lean in is that the way we think about it is that we want to be a partner to other organizations to be able to deliver this type of care. We think about our business as almost modular pieces on both the operation side as well as the technology side. We don't look at PACE as just a huge complex machine, but rather what are the transportation needs, what are the care planning pieces, what are the primary care pieces, right? Is how do we build both operational capability and technology capability around all of that so that we can go and have a menu of options to be able to partner with others. And at the end of the day, like the two of us, being kind of first generation Chinese immigrants, we have a differentiated understanding for some Chinese speaking senior communities here in Southern California. However, we can't pretend or understand the specific needs for other populations. That's why we also think that this type of strategy will allow us to be able to operate and scale our impacts to others while having a turnkey solution, being a turnkey partner with them, all the way to help all the way from application to operations.
Now, talk me through you this latest round of funding. Who are some of the key participants, and where you'll be investing? Those funds.
Yeah, so we have a unique mix of investors that really reflect the scope of what we were trying to build here at Scene Health. 8VC Sebastian, there has been a partner through and through from the very, very beginning, where he independently had developed a thesis around a tech-enabled pace. And once we found each other, he really gave us the resources to really go after this vision. But we also have the support of Basis Stats, which typically focuses on a lot of unique businesses, but also core bread and butter on ML and AI infrastructure. We also have prime time partners who specializes in aging specific focus infrastructure. And then we'll have a few other firms like Virtu, which is very much early stage healthcare firm, as well as our strategic partners, Strata Health.
I'm so excited for you guys and what you're doing. Let's look ahead. Let's put your let's put your forward-looking hats on here. Looking ahead, what does success look like for Scene Health in 5 years, both in terms of reach and impact on underserved communities?
Yeah. I once again gonna go back to our almost our early point, right? We want to be able to empower others to be able to launch and expand the access to pay services. Today, it is remains pretty difficult. The barrier to entry is still extremely high, and we want to get to a point where we can actually showcase to everybody who's interested around how exactly PACE works in almost a transparent, open model, right? We want to be able to visualize just how many touch points happen on a per participant basis from the minute they walk into the door. And we can showcase that this is how this model is so different than everything else that's out there on the market. And then this is how you actually go about building this and really having a playbook and blueprint for any other organization to be able to do this at scale. But in addition to that, right, we are by no means on our own. We understand that we are standing on the shoulders of giants. There's been so much work that went into developing this model and growing it over the past 50 years. We want to be good stewards. And so we're actively sharing a lot of our learnings, a lot of our expertise with the rest of the industry, hoping to be able to uplift it. And in addition to that, like we think that there's a huge amount of room to expand, even just in Singapore Valley, where we are situated today, because of the growing needs. As we look forward over the next 5-10 years, we want to be able to launch and operate many of these centers across California, but really the rest of the US, but hopefully be the empowerers and partners for many other organizations to be able to create this type of model in their communities. Yeah, and we'll see in many ways, PACE is an incredible model to build upon, but it's also very much designed for folks who are very highly frail and need a ton of support at home in their communities. But we really strongly believe that this model should be the default care model for essentially most seniors. But in order to get there, we need to figure out fundamentally what are the core services that can be adapted to different segments of the population with different type of conditions, and how do we bring the cost down from, let's say, like $100,000 a year down to a much more approachable range that can be accessible to middle income families. We can dream all we want, but all of these things all the way come back to today, which is we believe in show, not tell. We believe in learning to walk before we can run, which is why we're laser focused on how do we build our first center, launch it, and really prove to the industry and to ourselves that we can do this as well as anybody else, and we can have the data, the research, and everything else to really prove to that. And then after that, we can think about how do we really scale this model.
I'm so excited for you guys, and I look forward to staying in the loop along the way. Like, please let me know when there's some new announcements to to highlight because I think it's really cool what you guys are doing and very impactful, and appreciate all that you're doing. But wishing you the best of luck. Thanks for joining us here today, and congratulations on all your success so far. I know you'll go super far, especially with this with the bond that you two have.
Yeah, thank you. Appreciate the time. Yeah, we definitely appreciate it as well.